All right, so here we're going to be looking at UCL and palpation of the insertion and origin of the UCL to see if they're having any pain with just general palpation, right? It might be indicative of a UCL injury, especially if they're pointing to the inside of their elbow. So I think it's important we look at the medial elbow structure. So if you lift your arm up, obviously we have your medial epicondyle here, so you'll palpate on that area. If you drop off just about an centimeter to an inch off distally, you'll feel the common flexor tendon and where that inserts in the medial epicondyle. Sometimes that can be tender as well. But really, if you think about the origin insertion of the UCL, you have medial epicondyle, which is the proximal portion, and the distal portion is this area we call the sublime tubercle, which is along the ulna. So if you find the tip of the ulna and you work your way down, it's kind of this cross section about 2 centimeters down from the tip of the ulna. If you push into this area, it might be more indicative of a distal injury to the UCL. And so we'll also have some other videos that look at stability testing of the UCL, but those are two areas where you should palpate always if you suspect a UCL injury.